Hi, my name is Mike. I'm a physical therapist assistant here at Dynamic Physical Therapy. A couple of the techniques that I use here at Dynamic is cupping therapy and taping therapy. With cupping therapy, it's very similar to a fascial release. The fascial system is like a spider web through our body, kind of holds us nice and tight. As a cupping release, a cupping is a negative release, so it kind of releases backwards from what we do. So some of the other techniques we use are more positive in pushing into your skin. This is more of a release off your skin. So taping and cupping kind of use that same idea of opening up the skin and releasing some of that fascial tissue. The benefit of that is increased lymph drainage and increase in blood flow, which is basically the healing force of our body. We heal based off of our blood flow. So the more blood, the more nutrients we get to the area, the faster we can heal from that specific area. Typically with cupping, you're going to see some markings. Markings are typically, they'll call them stagnation, is typically what you're going to hear. Stagnation, think of like a river that runs quick, has nothing sitting in it. It's clear, it's clean. A river that's slow, muddy, brown, it's dark. That stagnation is the same way with your body. So where you're tight and you're stiff and you have that low stagnation, it's gonna look a little darker circles, a little redder. And then areas that you're not having that tightness and that stiffness, it's a lot clearer. Doesn't have much issues with that. With cupping therapy, we have a lot of good success with this. Most of my patients feel relief instantaneously. They get up from their laying position and they're standing up. They can usually feel it as soon as they're walking out the door. A lot of that is that release of that fascial tissue. As that fascial tissue is getting released, now you're able to move without that spider web keeping you stuck. That's one of the many different techniques that we use here at Dynamic.